So before I started using SEER, I did some background research and found that mantle cell lymphoma is a type of non-Hodgkin's lymphoma that wasn't established as a type of lymphoma until 1992. A lot of research has been done on the type of treatments and its effectiveness against mantle cell lymphoma, but very little has been done with mantle cell lymphoma, its incidence, survival, and demographic factors. So there are 61 different types of non-Hodgkin's lymphoma, and mantle lymphoma consists of 6% of those cases, which is roughly around 3,000 to 4,000 cases. Common factors seen at the time of diagnosis are a median age of 58 years. Males tend to have a higher incidence rate than females do, and patients present at an advanced stage. Usually there is extranodal involvement such as the bone marrow, blood, liver, and GI tract. The treatment of mantle cell lymphoma can be grouped into two categories: more intensive or less intensive. There is currently no standard treatment for mantle cell lymphoma. While I was doing research, I found this study on overall survival, and it was comparing two studies previously done. The more recent study had a higher overall survival of 5 years compared to the study that was done earlier, which had a overall survival of 3 years. This may be because of new innovations in technology and patient care. So as I said before, I use SEER to gather my data, and SEER is a database that collects data on cancer cases and has 17 different registries across the United States. When using SEER, I had a few exclusions in my data, which included unknown or unspecified race or age at diagnosis, patients that were 20 years or younger than 20 years, and exempt the Hispanic ethnicity. The reason why I excluded patients younger than 20 was because there were relatively few cases of mantle cell lymphoma in that age range, because mantle cell lymphoma tends to present at an older age for patients. The reason why Hispanics were excluded was because during the 1992 to 2007 time period, it wasn't reliably recorded in SEER. So after getting data from SEER, I exported it to Excel and created different types of graphs and tables. In this table, you can see that the white male category has a significantly higher incidence rates than all the other categories. You can also see that males have a higher incidence rates than females do. This graph shows that the white males have higher incidence rates across age groups compared to the other categories. What's interesting about this graph is that for the black and other category, the number of percentages of cases are highest around the 60 to 69 age group, while for the white category, it's 70 to 79, which contradicts my my research that I did before that said that the median age would be around 58, which isn't true to this data here. These two graphs compare the 2-year and 5-year relative survival rates by sex. And you can see here that females have higher survival rates, 2-year survival rates than males do, even though for the white category, it's slightly similar, but the female category is still higher. For the 5-year relative survival rate compared to the 2-year relative survival rate, it decreases and starts to level out for the genders. And the reason why the percentage alive decreases is because after a period of time, people begin to die, and that's natural because mantle cell lymphoma patients tend to present at an older age, so they might die of other reasons before mantle cell lymphoma gets them. Limitations in this study include SEER did not provide any data on the type of treatment done. Changes in classifications of lymphoma may have led to misclassifications over time. Risk factors for worse survival, such as those in the mantle cell lymphoma International Prognostic Index, were not available, and lack of information on insurance and social economic status limit the ability to draw any conclusion or some conclusions about relationships between the demographic factors, incidence, and survival. Conclusions that can be drawn from the data are gender and race can affect the incidence in mantle cell lymphoma. There's a strong relationship between age and the incidence of mantle cell lymphoma, especially for white males. There can be further research done to examine the relationships between age, race, and genetic and environmental factors that influence mantle cell lymphoma. Lastly, during this time period, there are very few differences in survival across gender and racial categories. I'd like to thank Dr. Flowers and his team, the SSRP program, and the Winship Cancer Institute. Questions?
Yeah. Why do you think some of the reasons are that different races present at different ages? So why would Black patients peak at an earlier age as compared to white patients?
Well, the difference in race may be due to the fact that mantle cell lymphoma generally is caused by gene expressions, and races have different genomes. The genomes express differently. So what might be happening is that the races are expressing different types of genes, which may cause them to express at different times. Any other questions?
Actually, I think also to your question, the lifestyle. You see, the lifestyle of Black peoples and white peoples are completely different. That also affect this type of incidence. You see, incidence is mostly similar, but the onset of age 5 years later. So lifestyle may be another factor of that.
Other questions? Okay, I think we'll take a short break.
Yay.